Good afternoon. This is All India Radio. I'm Valsa Williams and with me is Anita Anand with the Midday News. The headlines. Prime Minister Narendra Modi interacts with doctors and health workers of Varanasi through video conferencing, gives new mantra of Jahan Bimar Wahin Upchar in the fight against COVID pandemic. Union Health Ministry asks state governments to emulate the best practices in various districts to tackle COVID pandemic. Centre issues an advisory to states and union territories to protect vulnerable sections of society affected by the pandemic. Niti Aayog Vice Chairman Rajiv Kumar says the economy will have a stronger and faster recovery after June. Countrywide Ayush COVID-19 counselling helpline operationalised. Over 3,57,000 COVID patients recover from COVID-19 in the last 24 hours. National recovery rate improves to 87.25%. Cumulative number of COVID-19 vaccine doses administered in the country exceeds 19 crore. Power Ministry intensifies efforts for power restoration in the areas worst affected by Cyclone Tauktae. Enforcement Directorate raids premises linked to businessman Navneet Kalra in connection with alleged hoarding and black marketing of oxygen concentrators. In Assam, inaugural session of the State Assembly begins today. In Guwahati, newly elected legislators take oath. As the number of COVID cases is on the rise, we appeal to our listeners not to lower their guard, take all precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi today gave a new mantra of Jahan Bimar Wahin Upchar in the fight against COVID pandemic. He said that we have to secure our children from the clutches of this pandemic and get ourselves prepared for this fight.
महामारी के इस हमले को आपने काफी हद तक संभाला है, लेकिन अभी संतोष का समय नहीं है। हमें अभी एक लंबी लड़ाई लड़नी है। अभी हमें बनारस और पूर्वांचल के ग्रामीण इलाकों पर भी बहुत ध्यान देना है। और अब मंत्र हमारा क्या होगा? हर व्यवस्था के लिए, हर इकाई के लिए नया मंत्र यही है, जहां बीमार वहीं उपचार। ये हम भूले नहीं, जहां बीमार वहीं उपचार। जितनी हम उपचार उसके पास ले जाएंगे, उतना हमारी हेल्थ व्यवस्था पर दबाव बहुत कम होगा।
He was interacting with the doctors, paramedical staff and frontline workers of his parliamentary constituency Varanasi in Uttar Pradesh.
कोरोना के इस कठिन समय में हमारे काशीवासियों ने और यहाँ काम कर रहे हर एक जन ने वाकई इस कथन को सार्थक सिद्ध किया है। आप सभी ने शिव की कल्याण भावना से ही काम करते हुए जन जन की सेवा की है। मैं काशी का एक सेवक होने के नाते हर एक काशीवासी का हृदय से बहुत बहुत धन्यवाद देता हूं। विशेष रूप से हमारे डॉक्टर्स ने, नर्सेस ने, टेक्नीशियंस, वार्ड बॉयज, एम्बुलेंस ड्राइवर्स, आप सभी ने जो काम किया है वो वाकई सराहनीय है।
Emphasizing on the need for vaccination, the Prime Minister said we must get ourselves vaccinated when the turn comes and must make vaccination a collective responsibility.
सेकंड वेव में हमने वैक्सीन की सुरक्षा को भी देखा है। वैक्सीन की सुरक्षा के चलते काफी हद तक हमारे फ्रंटलाइन वर्कर्स सुनिश्चित रहकर लोगों की सेवा कर पाए। यही सुरक्षा कवच आने वाले समय में हर व्यक्ति तक पहुंचेगा। हमें अपनी बारी आने पर वैक्सीन जरूर लगवानी है। कोरोना के खिलाफ हमारी लड़ाई जैसे सामूहिक अभियान बन गई है, वैसी ही वैक्सीनेशन को भी हमें सामूहिक जिम्मेदारी बनाना है।
He said the importance of yoga and Ayush in the fight against this virus is being seen worldwide. Praising the Varanasi model in the fight with the pandemic, the Prime Minister said everybody in the country is talking about the way the city fought this pandemic. New machines for testing, facilities for oxygen supply and other health infrastructure-related things have become an example for others. He especially mentioned Kashi Kavach and said it is also an innovative experiment of the administration which is helping people to get the facility of telemedicine, medicines and other related things necessary for fighting against this pandemic. He said it is not the time for rest. Instead, we have to fight a long battle with COVID in Varanasi and other rural areas of Purvanchal.
हमारे देश में पिछले कुछ वर्षों में जो योजनाएं बनी, जो अभियान चले, उसने कोरोना से लड़ने में काफी मदद की है। स्वच्छ भारत अभियान की वजह से बने शौचालय हो, आयुष्मान भारत योजना के तहत मुफ्त इलाज की सुविधा जो की गई वो भी इसमें लाभ करता रही है। उज्ज्वला योजना की वजह से मिले गैस सिलेंडर हो, जनधन बैंक खाते हो या फिर फिट इंडिया अभियान हो, पूरे विश्व में कोरोना के खिलाफ लड़ने में योग का भी महात्म्य प्रचलित हो रहा है। इन सभी ने कोरोना के खिलाफ लड़ाई में लोगों की ताकत बहुत बढ़ाई है।
The Prime Minister said not just the people of Varanasi but people from Purvanchal and even from Bihar come to the hospitals of the city for treatment. In the last 7 years, there has been tremendous work for the development of health infrastructure in the city, which is helping during this crisis. Mr. Modi started his interaction by paying tribute to those who lost their lives during the battle with COVID in the city. He said our collective efforts will definitely give results and with the blessings of Baba Vishwanath of Kashi will successfully win the fight against COVID-19.
The Union Health Ministry has asked state governments to emulate the best practices shared by various district and field officials to effectively tackle COVID pandemic. In a letter written by Union Health Secretary Rajesh Bhushan to all the state health secretaries, he has suggested them to replicate the innovative practices by customizing them to the local needs. Prime Minister Narendra Modi interacted with the district and field officials of nearly 20 states and union territories on Tuesday and Thursday and discussed in detail the innovative strategies adopted by them to effectively manage COVID-related issues in their areas. He said also that asked them to share the best practices to the Central Health Ministry so that these innovative ideas can be further adopted by more states and districts. Our correspondent takes a look at few of the novel ideas shared by the states and district officials.
Marching ahead with the vision that new challenges need new solutions, several states and district administrations are lauded for their exemplary work in handling the COVID-related situation. Among them includes the idea of active cooperation of RWAs in establishing COVID care centers and isolation centers, effectively demonstrated by Gautam Budh Nagar administration of Uttar Pradesh, where on one hand Madhya Pradesh shared their prompt isolation and containment measures, Haryana depicted their work site and drive-through vaccination center model and digital solutions to the health emergencies. District administration of Varanasi shared the effective use of Kashi COVID Response Center to provide one-stop solution for all COVID-related queries of common citizens. Chennai shared their effective use of taxi ambulances, whereas Chandigarh showed utilization of Ayush medicines and Ayush health facilities for COVID management. Janjgir Champa in Chhattisgarh demonstrated their push to promote Ayush Kadha, and Ahmednagar in Maharashtra shared their tiffin box service at the COVID care centers. Mobile OPD, Oxygen Mitra, Oxygen nurses, door-to-door RT-PCR and rapid antigen testing were also among the best practices shared with the states, which not only focus on effective COVID management but also on minimizing the wastage of essential medical necessities. Anand Chaturvedi, AIR News, Delhi.
The Centre has issued an advisory to states and union territories to take immediate steps for the protection of vulnerable sections of society, including women, senior citizens and children who have been orphaned due to the COVID-19 pandemic. In its advisory, Home Ministry said several states and union territories have initiated action and strengthened their machineries to support the vulnerable groups, and various success stories and best practices are now available where emergency services have been provided to the vulnerable groups impacted by COVID-19. However, in order to meet the new challenges arising out of the recent wave of COVID-19, the ministry has urged to undertake an immediate review of the existing facilities for vulnerable groups, especially for children who have been orphaned, senior citizens who may require timely assistance, and members of SCs and ST communities who may need guidance to access government support facilities. It has asked in the review may include steps taken by sensitization of police personnel, coordination with agencies and departments concerned, as well as communities and civil society organizations.
Niti Aayog Vice Chairman Rajiv Kumar has said the economy will have a stronger and faster recovery after June than most people expected. He said the year will end on a positive note. In an exclusive interview to AIR News, Mr. Kumar said the kind of very sharp V-shaped recovery the country was expecting will be less pronounced as the economy suffered due to localized lockdowns and the consumer and investor sentiment got a beating. The Vice Chairman of the apex planning body of the country said by the end of June this year, this will be behind us and the vaccination program would also have gone to another level.
Kind of recovery we were expecting in April and May of this year would be less pronounced. Otherwise, we were hoping to have a very sharp V-shaped recovery. My own estimate is that all of this will be surely behind us by the end of June. And in the first quarter, that is April to June, we will still get a very positive growth rate, but not as high as got without this. And our vaccination program would have taken strength, and after which, therefore, I expect the economy to have a recovery stronger and faster than most people expect.
The Niti Aayog Vice Chairman said the output of the coming Kharif season will not be affected much by the second wave of the pandemic. Mr. Kumar said the country is going to have a normal monsoon for the fourth year in a row, and the reports about the summer season are also encouraging. The area covered is also quite substantial.
I'm convinced that the agriculture output of the coming Kharif season will not be affected because once more the meteorological department has said that the monsoons are going to be normal, and also the summer crops which are going on now, the reports are that the area covered is quite substantial.
The exclusive interview with Niti Aayog Vice Chairman Dr. Rajiv Kumar on safe livelihood and infrastructure work during COVID-19 pandemic in the Surkhiyon Mein program will be broadcast by the News Services Division of All India Radio tonight. This can be heard on FM Gold channel and additional frequencies from 7:40 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. Union Health Minister Dr. Harshvardhan will chair a meeting today on the COVID-19 situation and vaccination progress with health ministers, lieutenant governors and administrators of 9 states and union territories. The states and union territories participating in the meet include Chhattisgarh, Goa, Himachal Pradesh, Puducherry, Andaman and Nicobar Islands, Chandigarh, Dadra and Nagar Haveli and Daman and Diu, Ladakh and Lakshadweep. The Health Minister has been continuously chairing meets with health authorities of different states and union territories for the last 3 days in order to assess the evolving situation and take curative actions.
AIMS Director Randeep Guleria has rebuffed certain claims made in few reports being circulated across different media platforms that black fungus or mucormycosis is caused due to consumption of raw food. Clarifying further on this, Dr. Guleria said the assumptions in these speculative reports are unfounded. He also rebuffed claims which suggest that mucormycosis is linked with the quality of medical oxygen given to the patients in healthcare facilities. Dr. Guleria added that the disease is also being witnessed in patients under home isolation who have not been given medical oxygen. Expressing concern over increasing number of patients of black fungus, Dr. Guleria stressed on the necessity to scale up its prevention strategies. He said good control of blood sugar levels, especially by those on steroids, and careful administration of steroid dosage in COVID patients as key to prevention of the disease. Dr. Guleria said indiscriminate usage of steroids and administration of high doses when not medically indicated can lead to high blood sugar levels and a high chance of mucormycosis. You're listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi interacts with doctors and health workers of Varanasi through video conferencing, gives new mantra of Jahan Bimar Wahi Upchar in the fight against COVID pandemic. Union Health Ministry asks state governments to emulate the best practices in various districts to tackle COVID pandemic. Centre issues an advisory to states and union territories to protect vulnerable sections of society affected by the pandemic. Niti Aayog Vice Chairman Rajiv Kumar says the economy will have a stronger and faster recovery after June. Countrywide Ayush COVID-19 counselling helpline operationalized. Over 3,57,000 COVID patients recover from COVID-19 in the last 24 hours. National recovery rate improves to 87.25%. The cumulative number of COVID-19 vaccine doses administered in the country exceeds 19 crore. Power Ministry intensifies efforts for power restoration in the areas worst affected by Cyclone Taukte. Enforcement Directorate raids premises linked to businessman Navneet Kalra in connection with alleged hoarding and black marketing of oxygen concentrators. In Assam, inaugural session of the State Assembly begins today in Guwahati. Newly elected legislators take oath. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the Midday News. A countrywide Ayush COVID-19 counselling helpline has been operationalized. The toll-free number is 14443. The helpline is operational pan-India from 6 a.m. to 12 midnight all 7 days of a week. Through the helpline 14443, experts from different streams of Ayush, namely Ayurveda, homeopathy, yoga, naturopathy, Unani and Siddha, would be available to address queries of the general public. These experts would not only be providing counselling and feasible remedies to the patients, but would also guide them about the availability of nearby Ayush facilities. The experts would also be suggesting post-COVID-19 rehabilitation and management approaches to the patients. The helpline is IVR, as in interactive voice response, equipped and currently available in Hindi and English languages. The helpline will initially take 100 calls simultaneously, and the capacity would be increased in future as per requirements. The nation continues to march strongly on its path of COVID recovery, with substantial decrease in the total number of active cases. In the past 24 hours, over 3,57,000 COVID patients successfully recovered from the disease, whereas in the same time span, 2,59,591 fresh cases were recorded nationwide. With this, the recovery rate in the country has further improved to stand at 87.25%. The cumulative share of active COVID cases in the country also continues to witness consistent decline and comprises nearly 11.63% of the total reported cases. The Health Ministry has informed that currently over 30,27,000 people are reported to be suffering from the viral pandemic and are either hospitalized or under home isolation. The ministry added that so far over 2.27 lakh people have recovered from the COVID-19 infection in the country. 10 states including Maharashtra, Karnataka, Chhattisgarh, Delhi, Tamil Nadu, Uttar Pradesh, Punjab, Madhya Pradesh, Gujarat and Kerala continue to be the major hotspots of the viral pandemic. Nearly 75% of the new cases are reported from these 10 states. The Health Ministry has informed that 4,209 COVID-related deaths were reported in the last 24 hours, taking the cumulative toll to 2,91,331. with a special focus on the 5-point principle of test, track, treat, isolate and vaccinate. The number of cumulative COVID-19 tests reported by the Indian Council of Medical Research (ICMR) has surpassed the figure of 32 crore 44 lakh. The Apex Medical Research Body has informed that in the past 24 hours, more than 20,61,000 samples were tested in the country.
India has achieved a new landmark in its vaccination drive as the cumulative number of COVID-19 vaccine doses administered in the country exceeded 19 crores. Over 14,82,000 vaccine doses have been given to the beneficiaries in the past 24 hours. The country has so far administered more than 19 crore 18 lakh doses of COVID vaccine. Out of the total, nearly 14 crore 91 lakh people have been given the first jab of the vaccine, whereas nearly 4 crore 28 lakh beneficiaries have been fully vaccinated with both the required doses. The Union Health Ministry said that more than 7,36,000 doses of the COVID vaccines were given to people in the age group of 18 to 44 years in the last 24 hours. With this, over 85,84,000 beneficiaries in this age group have been given the first dose of the COVID vaccine. The centre is continuously reviewing and monitoring the vaccination program at the highest level as a tool to protect the most vulnerable population groups in the country from COVID-19. The liberalized and accelerated Phase 3 strategy of COVID-19 vaccination has come into force from 1st of this month, under which people in the age group of 18 to 44 years are also being vaccinated. In Chhattisgarh, post-COVID OPD services will be started in all district hospitals. The State Health Department has issued instructions to district collectors of all the districts in this regard. More from our correspondent.
The Health Department of Chhattisgarh has asked the collectors of all the districts to ensure the availability of experts of medicine, eye, ENT, as well as physiotherapists in the post-COVID OPD to be started in the district hospitals. District hospitals have also been instructed to conduct OPD 3 days a week for counseling and treatment related to mental health problems such as depression, restlessness, and sleep deprivation. The Health Department has said in its circular issued to the collectors that it has been observed that some patients experience symptoms like difficulty in breathing, fatigue, and weakness even after being discharged from the hospital after treatment of COVID. Apart from this, symptoms of mucormycosis or black fungus have also been seen in some patients. Due to this, the regular follow-up of COVID patients is very important. Vikalp Shukla, AIR News, Raipur.
In Madhya Pradesh, the state government will provide financial assistance of 1 lakh rupees to the families of those who died due to COVID-19 during the second wave. State reported 4,952 new cases and 88 deaths, while 9,746 patients recovered from the infection yesterday. More from our correspondent.
Chief Minister Shivraj Singh Chauhan said that rupees 1 lakh ex gratia will be given to the kin of those who died of COVID-19 in the second wave. Meanwhile, COVID positivity rate declined to 6.3%. The state ranks 16th in the country in terms of infection. The active cases in the state stands at 72,725. Both Indore and Bhopal have more than 11,000 active cases. More than 70,000 tests are being conducted every day. Pooja P. Vardhan, AIR News, Bhopal.
Gujarat has recorded 4,773 new cases of COVID-19 yesterday. According to the State Health Department, 8,308 patients recovered during the last 24 hours and were discharged from the hospitals.
Prime Minister Narendra Modi has condoled the demise of noted environmentalist Sundarlal Bahuguna, terming it as a monumental loss for the nation. He said Bahuguna manifested the centuries-old ethos of our country of living in harmony with nature. Mr. Modi said the simplicity and spirit of compassion with which Bahuguna, who was also the pioneer of the Chipko movement, lived, will continue to inspire everyone through ages. Noted environmentalist Sundarlal Bahuguna passed away today in Rishikesh, Uttarakhand. He was being treated for COVID-19 related complications at AIIMS Hospital in the city. Governor Baby Rani Maurya and Chief Minister Tirath Singh Rawat have expressed grief at his death. The Union Power Ministry has taken active measures for power restoration work in the areas worst affected due to Cyclone Tauktae. The Power Secretary has been holding regular review meetings with the State Power Utilities, Power Grid Corporation of India Limited (PGCIL) and Power System Operation Corporation Limited to provide assistance to tide over the current critical situation caused by the cyclone. A special review meeting was held yesterday to expedite the power restoration works in Gujarat and the Union Territory of Diu, which have been the worst affected areas. PGCIL informed that a team of 150 plus experienced manpower with emergency restoration system has reached Gujarat and that work has commenced to restore the worst affected 220 kilovolt line providing power supply to Diu. PGCIL also provided the list of contractors who would be contacted for the restoration works.
The Enforcement Directorate ED today raided premises linked to the businessman Navneet Kalra and his associates in connection with alleged hoarding and black marketing of oxygen concentrators. Our correspondent reports that the searches are being conducted at various locations in the national capital under provisions of the Prevention of Money Laundering Act (PMLA). ED had recently booked Kalra and others under the PMLA. The police had recovered more than 500 of these life-saving machines from a restaurant owned by Kalra in Khan Market. Kalra was sent to 14-day judicial custody by a local court in Delhi yesterday. The three-day session of the Assam Assembly has begun in Guwahati today. This is the first session of the 15th Legislative Assembly. Pro Tem Speaker Fani Bhushan Chaudhary administered the oath to all the newly elected legislators. Chief Minister Himanta Biswa Sarma also represents Jalubadi Assembly constituency, was the first to take oath. After him, former Chief Minister and BJP legislator from Majuli, Sarvananda Sonowal, took oath. The legislators took oath in various languages including Assamese, Bengali, Bodo, Nepali and Sanskrit.
On the fifth day of its search and rescue operation off Mumbai coast, the Indian Navy today recovered the mortal remains of 23 more crew members of the ill-fated barge P305 that went adrift following Cyclone Tauktae on Monday. Subsequently, the death toll has risen to 51, while 24 people are still missing. A defence press release has informed that INS Beas has entered Mumbai's harbour with the mortal remains, while other ships and aircraft continue the search and rescue mission.
In Maharashtra, 13 Naxalites were killed in an encounter between C-60 unit of State Police and Naxalites in Gadchiroli district. The C-60 unit of Maharashtra Police received confidential information about the presence of large number of armed Naxalites in the Itapalli forest area in the district and that they were preparing for an attack on Kasansur police station. According to the available information, the Naxalites opened fire on the police personnel while the search operation launched by the C-60 unit was in progress. The Naxalites were killed in the encounter that broke out in the forest area when the police personnel started fire in retaliation.
Now let us take a look at the weather forecast for today. The national capital Delhi will have a maximum temperature rising up to 35 degrees Celsius. The city recorded a minimum temperature of 19 degrees. Mumbai is likely to have a partly cloudy sky with maximum temperature will be nearly 34 degrees. Minimum temperature was 26 degrees. Chennai is expected to have thunderstorm with rain. Temperature will move between 26 and 36 degrees. Kolkata may have a partly cloudy sky. Jammu will have a mainly clear sky, becoming partly cloudy towards afternoon or evening. Srinagar will have a partly cloudy sky with possibility of rain or thunderstorm or dust storm. The temperature will hover between 10 and 26 degrees Celsius. Leh may see a generally cloudy sky with temperature moving from 4 to 19 degrees. Gilgit will also have a generally cloudy sky with possibility of rain or thunderstorm or dust storm. Muzaffarabad is expected to have a partly cloudy sky with possibility of rain or thunderstorm or dust storm. Maximum temperature expected around 34 degrees. Minimum was 15 degrees. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi interacts with doctors and health workers of Varanasi through video conferencing, gives new mantra of Jahan Bimar Wahin Upchar in the fight against COVID pandemic. Union Health Ministry asks state governments to emulate the best practices in various districts to tackle COVID pandemic. Centre issues an advisory to states and union territories to protect vulnerable sections of society affected by the pandemic. Niti Aayog Vice Chairman Rajiv Kumar says the economy will have a stronger and faster recovery after June. Countrywide Ayush COVID-19 counselling helpline operationalised. Over 3,57,000 COVID patients recover from COVID-19 in the last 24 hours. National recovery rate improves to 87.25%. Cumulative number of COVID-19 vaccine doses administered in the country exceeds 19 crore. Power Ministry intensifies efforts for power restoration in areas worst affected by Cyclone Tauktae. Enforcement Directorate raids premises linked to businessman Navneet Kalra in connection with alleged hoarding and black marketing of oxygen concentrators. And with that, we end the midday news.